Hello friends, I'm Dr. Sunil Sani, trauma neurosurgeon, expert in limb lengthening, deformity correction, pain management, ozone therapy and various nutraceutical therapy including hydrogen therapy. Today we have a patient, Mrs. Harjeet Kaur, and she is from Pune. She is having severe backache with bilateral lower limb radiculopathy. She is not able to walk from last 2 years. From last 2 years, activities of daily life is almost restricted. She is not able to walk. She can walk for 2 minutes. Again, she had very severe pain when she sit. Again, pain goes off, and then when she start walking again, she can walk only for 2 minutes. So this is a very typical symptom where patient says that I can sit for a prolonged period of time but I cannot walk, and her age is 57. So after 50 years of age, when patient says that I can sit but I cannot walk, I cannot stand, so typically patient has such kind of complaint, or I can sit with forward bending, but I cannot walk prolong, I cannot stand prolong, I can sit for a prolonged time. So this typically indicates the patient is suffering from spinal canal stenosis, which may be because of bony canal stenosis or maybe because of disc prolapse. तो अभी आप कितना चल नहीं पाते हो, कितनी दूर चल पाते हो?
नहीं, बिल्कुल नहीं चल पाती हूँ।
बिल्कुल नहीं। ये ऐसा कब से? 2 साल से?
2 साल से।
2 साल से बेड पे ही हो? मतलब बहुत कम चल फिर रहे हो?
हाँ, मतलब
बैठने में कम तकलीफ है?
हाँ, बैठने में घर का काम थोड़ा बहुत तो कर लेती हूँ।
ओके ओके। और कितनी दूर चलने के बाद दर्द आ जाता है?
हाँ, जैसे 2-4 कदम, 5-6 कदम बस इतना चल पाती हूँ।
So she is saying that she is able to walk only 5 to 6 steps, although she is doing all the works at the home, but she can sit but cannot stand or cannot walk for a prolonged period of time. It indicates that patient is suffering from spinal canal stenosis. Now, when we go for stenosis in her MRI, we have read that there is L3 and L4 disc prolapse, and there is significant compromise in the canal diameter. So there are two ways which we can deal in this such kind of conditions. One, we can go for surgical decompression with fixation is very, very important in such kind of cases. Another is non-surgical or minimal intervention, where we are going for intradiscal ozone nucleolysis as well as facet joint block injections, and along with that we will go for physiological pain portals and ozone autoimmunotherapy, other therapies, and then physio rehabilitation, M regime, which is very, very important because these are the degenerative spine disease. She is also having pain in the knee also. So basically she is suffering from degenerative spine disease, and she says that when she is walking, she's walking on very soft surface, or she says she is walking on cotton surfaces. So these are typical indications of neuropathies. So she is having neuropathy. We'll go for ozone autoimmunotherapy for that. Now the patient is in the prone position for intradiscal ozone nucleolysis, and we are preparing, draping, everything. We are in the OT, and all the procedures are done in local anesthesia, plus minus sedation if required. If the patient is anxious, the patient is, then we can give sedation. Otherwise, we usually do in the local anesthesia. Patient is very much comfortable. Now the patient in the prone position, the trolley is completely ready, and we are going to painting and draping, and then we will go for the intradiscal ozone nucleolysis. So the painting and draping has been done. Now we are basically marking, and from up to down we are going, and then we will put the local anesthesia at the required site and then go for intervention. So we have marked. Now we are putting local anesthesia, and we have marked the points also with the help of our picture. This is the CR picture which we have already seen. Now this is the Scottish dog view, and Scottish dog view we will enter. Now I am giving local anesthesia, generous amount of local anesthesia, so that patient will not feel any difficulty. So we are going at 2 level L3 and L4. We have given generous amount of local anesthesia. We are just waiting for 2 more minutes, and now we will enter into the view, that is the Scottish dog view, in which we are going to enter. First I will go at L4 level. Okay. So we have entered inside the disc. Now you can see here, this is our intradiscal needle at 2 levels, L3 and L4 level, and we are just in the middle. We will insert more bit, and then we will insert the dye to check again whether we are in the correct position or not. So it's a very simple procedure. If I think you can appreciate here, this is the disc actually. Contrast ko karo kuch. This is the vertebrae, and all the pictures are not of good quality, but this is the dye. Now the dye is spreading, it means the disc, the annular fibrous tissues are also broken. That's why dye is spreading. Confirm in another also. So these are 2 levels where we have put the dye. This is the L3 level and this is the L4 level. And now we will go for intradiscal ozone nucleolysis, where we will be injecting around 3 ml of ozone, 100 microgram per ml. And then we will inject around the foramen also, and then in the facet joints. That is how we do in such kind of cases, which will help in improving the canal stenosis. Along with that, we will augment this case with DSCB injection, that is also called physiological pain portals, physiotherapy, rehabilitation, lifestyle modification, and very, very important, that is M regime. That is how we treat patients of canal stenosis. Such conditions also with a very good results of almost 85 to 95%. Thank you so much.